I'm here with Dr. Darren Sush, and I asked him to stay because he is a board-certified behavior analyst, which is a wonderful thing always. But he's also a clinical psychologist who specializes in treating parents of children on the autism spectrum. He brings that full knowledge of what ABA therapy is like in a home to that practice, dealing with parents and all the stressors that they have, both because of the ABA therapy, let's face it, that adds stress to a parent's life, but all the other things happening as well. And I asked him to stay to talk with us about anger, and I was saying during the break that we're getting ready to do a whole series of shows on anger because, you know, we've done stuff on anxiety, we're going to do more stuff on anxiety, but the anger is pervasive in our community. We all have a certain amount of anger. Some of us deal with it, we all deal with it in different ways, but some of us get buried by it. Sometimes, I think sometimes I get buried, I have anger, and sometimes I get buried by it, and sometimes I'm okay, and then somebody will do or say something, and boy, it's like I'm right back there, right? So I wondered if you could talk with us a little bit about, why we're all having that anger, and maybe how we might work through that in therapy, and maybe give us some information that might help us today.
Sure. Well, first and foremost, I think the most helpful thing that I can say is that, and it sounds so simple, is that everyone gets angry. And I think if you are able to at least say that to yourself and accept that for yourself, that everyone gets angry and it's all right to be angry at things, then that puts you leaps and bounds ahead of the game. Yeah. Everyone does get angry. It's what you do with that anger that can be problematic, but at least accepting the fact that something happened and you can be angry about it is okay, and it's part of being a human being. And in many cases, like you mentioned, it's part of being a parent of a child with autism. There's a lot of stuff to be angry about. Someone's in your home all the time. You know, yes, they're doing great things for your kid, and a lot of parents fight to get those people in their homes. Mm-hmm. But, you know, someone's in your home all the time, and that could be something to be angry about. Or you could be angry that your child has to struggle with some of the things that they have to struggle with, or that they're not able to express themselves. Or you're angry at the fact that you're upset about those things. So I think it makes sense to be angry, and the first thing that you can do is accept the fact that you are angry about it, and then that helps you to be able to do something productive with that anger. Yeah. Sometimes the anger can lead you to be productive.
Well, I think you're right, because when we try to stuff the feelings and say, I shouldn't be feeling that, I shouldn't, I don't get anywhere when I try to do that. But I think that sometimes I am able to channel my anger in different ways, to educating someone sometimes when they make me angry, or doing something else that has nothing to do with that person that's productive in another direction, useful for me. So if I were a parent coming to your practice and I said, I really want to work on anger issues, because this could happen. This is not, we're talking about a friend of mine. If I were going to do therapy, this is exactly what I would say, because I see in my life, I said this to somebody the other day, there are so many times when I've had to be warrior mom that I can turn that on over nothing, and I would like to move past that in my life. Is that something that somebody could work on in your practice?
Definitely, and kind of like you're saying, that the teapot strategy never works. Trying to bury it down and hold it in, it just doesn't work, because it's going to pour out somewhere in your life. It's either going to pour out in your work, where it's just becoming more difficult, or your relationships with people you work with is going to struggle, your relationships with your family is going to struggle, or you're just not going to feel good. Yeah. So first and foremost, having someone to talk to, having someone who's there to listen, and whether that be someone like myself, or just a family member who's maybe removed from the situation, or a friend who you do feel comfortable expressing yourself to, then that's the first thing that parents can do for themselves to help with the anger, the anxiety, the depression that's likely going to come.
And it seems like those three things are very intertwined: the anger, the anxiety, and the depression.
Definitely. You could be depressed because you're feeling angry, and angry that you're anxious, and they all relate. We don't live on black and white spectrums. We're people that intermingle.
Yes. And those are normal reactions for us when we have a child who has been diagnosed with something. But it's also, I'm thinking, a fairly normal reaction for our teens once they realize, when they get that full awareness of, okay, the rules are a little bit different for me. I don't have it like everybody else. That those are kind of normal reactions to have.
Definitely.
Thank heavens for you, Dr.
Thank you.
It's such a wonderful, wonderful idea of having somebody who is a board certified behavior analyst who gets what that is like, being able to deal with those issues with parents of children with autism spectrum. Don't you love him?